Then how about the rhythm? Is it regularly regular? Sa, re, ga, ma, pa, da, ni, sa. So, is it regularly regular? Or is there any phasic irregularity whenever the person is taking respiration? So, typically, what happens during respiration, doctor? What happens during respiration? There are two phases of respiration. One is called inspiration, very good. Other is expiration, expiration. So, whenever you are inspiring air, what's happening? There is a negative intrathoracic pressure. Negative intrathoracic pressure. Whenever you are having inspiration. Agree? So that negative intrathoracic pressure, what will it do? It will suck the blood. It will suck the blood from the great veins and pours it into the heart. So all the great veins drain into which part of the heart? Right side of the heart. So the right side of the heart will have more amount of the blood, right atrium and right ventricle. That will make the interventricular septum to twist into the left side. So that is the reason what happened. The left side volume has become encroached by the right side encroaches into left side. So from the left side, the blood which is being pushed into the aorta will decrease. And because of that, what will happen? The pulse become weaker. Normally only pulse is weaker during inspiration and it is relatively more stronger in the expiration. This kind of a change in the pulse is basically called sinus arrhythmia. That is, with respiration it is changing. So that is what is a normal finding. Then, if it is irregular, if the pulse is irregular, sa, re, gagama, sa, re, gagama. So, instead of sarigama, it is becoming gagama. Then what is the underlying cause? If it is regularly irregular, sa, re, gagama, sa, re, gagama. Then, if it is regularly irregular. Whereas if it is irregularly irregular, sa, sa, re, 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 sa, 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 re, sa, sa, re, sa, sa, re, re, ga, ga. So, it is irregularly irregular. If it is regularly irregular, what is the cause? Atrial flutter, paroxysmal atrial tachycardia, they are the underlying cause. But if it is irregularly irregular, then it is atrial fibrillation, ventricular premature complexes, they are the underlying cause. But let me tell you, these are all theory discussion. It's not that patient examiner tomorrow in the final MBBS exam, they will put one irregularly irregular and check whether you will be able to find it or not. No, it's not like that. But examiner, when the discussion for the pulse comes, will start ripping you on each of these points. So you should be very sure at least to give one cause for each of these scenarios. Tell me now, regularly irregular. Where do you find, doctor? Paroxysmal atrial tachycardia or atrial flutter. Irregularly irregular, ventricular premature complexes and atrial fibrillation. They are the two scenarios that you need to remember. If you still have time, Manish is asking, sir, this video will be in YouTube, right? Oh yeah, definitely. Why not? Why not? Knowledge is supposed to be free, affordable, accessible anywhere, anytime, doctor. We strongly believe that. I'm really so happy to see 80 online MBBS final year examination completed students. So, going for the practical exam shortly. A wonderful opportunity. So definitely we will keep the video. But just tell your classmates and friends that, hey guys, final MBBS exam going Telegram group. Ask them to join, and you can tell your juniors also to join that who are finishing their ENT optal exam, and they can also subscribe in the online MBBS.com video library, where you have 300 hours of video lecture covering theory in medicine, surgery, gynocs, orthopedics and pediatrics, which is going to help you to quickly do the revision.